Hi there, Dr. Tyler Williams at Better Sleep SLC. Thanks for taking a minute to watch this video. You're here because you're looking into some dental sleep appliances to treat snoring or sleep apnea, which really has been an interesting and really incredible growing form of sleep apnea and snoring treatment over the past few years. And so we're here to answer some questions you have about your options and what to expect and what to plan for and what it is exactly, right? And go back to a story from October 2016 featured in the news about a tour bus driver who wrecked a tour bus and killed 13 people and I think injured 30 plus people. And the driver had sleep apnea, and so it sparked this whole debate and news lines about, hey, well, did the bus driver's company know that he had sleep apnea? Rather, was the company aware what needed to be done? And so, if you know anybody who's in trucking, they have to be tested for sleep apnea. And so we've come a long way as far as screening for this and looking for it. But there are also millions and millions undiagnosed because some people just think dealing with crummy sleep is the cards that you've been dealt and you just have to live with it. But I'm here to tell you that you don't, because I've seen people's lives change and I have a lot of fun helping people find and get treated for sleep disorders. And we work with a team of specialists and labs and some really great people who help us to deliver great care for people like you who are looking for answers to questions that you have. And it's been a fun journey, but also, most importantly, we've learned a lot about why people get sleep apnea, why it's so common, and what the options are. And something to keep in mind is that snoring and sleep apnea are two different things, but they're often related. So if you have snoring, doesn't mean you have sleep apnea. And if you have sleep apnea, you may not snore. Snoring alone is a nuisance, but it's not necessarily a medical condition that requires significant attention. Sleep apnea, on the other hand, does, and the most common kind is obstructive. That means your tongue is too large for your airway. You may have a normal-sized tongue. You might just have a small mouth or airway, or maybe your tongue just positioned differently gets in the way, but it obstructs or blocks your airway, which can cause snoring sound in some people, or some people have what's known as silent snoring, where you're gasping or not breathing, but there's not a lot of sound happening. So sleep apnea, on the other hand, is a medical condition that needs attention and treatment. And there's also a third one called central sleep apnea, and that's more neurological. It doesn't have as much to do with your anatomy, and that can be the kind of sleep apnea you have as well. So the first thing to do, kind of going through your journey, is get a home sleep test screening. Okay, and this is where you get a home sleep test sent to you, and a board-certified sleep physician will read that test and be able to give you a diagnosis. Hey, is this just snoring? Is this sleep apnea? Is this upper airway resistance? Is it something else? So you can get that out of the way. But, don't fall into the trap of thinking just sleeping on a different position every night or getting a different mattress or a bed or sleeping at a different angle is going to fix the problem, right? It might temporarily bandage the problem, but it's better if you get a screening. They're cost effective. They're generally covered by medical insurance or Medicare or your flex spending or your HSA. They're usually a few $100s at most, and it really tells a lot. Now, sometimes you'll also be recommended to do an in-lab sleep study at a hospital, but for most people now, the home sleep tests are good enough that that's a good starting point. And from there, then you meet with sleep team and get a plan together. Our niche here is oral sleep appliances. So if you can't wear a CPAP, or you're not a good candidate for surgery, or you don't want surgery, the oral appliance is the FDA approved treatment to sleep apnea in those cases. And a lot of times it's the frontline treatment if you are in the middle or low range of sleep apnea. And even in some cases now, if you're more severe, but you can't tolerate other types of treatment, the oral appliance is recommended, and we've seen some great results. You'll have what's called an AHI measurement. That's an apnea-hypopnea index. That's essentially measuring how many times per hour do you stop breathing or gasp. And if you're 5 or less, clinically, they would say you don't have sleep apnea. If you're 5 to 15, you're in that mild range. 15 to 30, moderate. 30 plus would be the severe range. When you're treated with an appliance or surgery or CPAP, we'd like to see you under 5. Under 10 is usually acceptable, but under 5 is kind of the gold standard if we can do that. And, we've seen patients as low as 1 or 2 after they get their appliance when we retest them to make sure that we've seen that improvement. Then we, have you meet with your sleep physician again for follow-up testing, and we see you back once a year for follow-up testing, make sure the appliance is fitting well and functioning. These appliances are Medicare approved. They are medical insurance approved. They are FSA and health savings account approved. Okay. They're not dental treatments. They are medical treatments. We call it dental sleep medicine because it's the bridge between dentistry and medicine, because these appliances go in your mouth. So you have to have the dental training and knowledge on how to fit them to your teeth and your bite and your mouth and not cause joint problems or jaw pain or mess up your dental work. But then you have to have the medical training so you know what to look for and how to look at tests and how to work with the sleep physicians and tie all these things together. So you want to make sure you're working with a team who understands those aspects and components of it, because if it's done wrong, you might feel like you're not getting the results, or your physician may say, hey, you got to just get surgery or go to CPAP, and you might be thinking, I don't want to do that. So make sure you find someone. If you are local here, give us a call, and we'd be happy to see you for a consultation and go over some options. If you're not local here in the Salt Lake City market, which a lot of people find us that are not, you can still give us a call or shoot us a text, and we have some offices around the country that we work with that we may be able to recommend. So thanks for taking a minute to watch this video, and we will see you on the next one. Leave some comments if you have questions or input, and look forward to hearing from you. Thanks.